career in medicine is challenging and highly rewarding. Becoming a doctor is a great way to make a significant and practical difference in the lives of people in need.
All doctors become interns and work within a hospital, and that involves taking a history from your patients, examining them, talking to them about what might be wrong, ordering tests, and then giving them some treatment in collaboration with lots of other people. Ultimately though, you then make decisions about what you want to do, and you can choose general practice, one of the specialties such as being a surgeon or a paediatrician, becoming a pathologist, working for an aid organisation, the government, or working in research and teaching. You come in the morning and you generally meet up with the senior doctor who's supervising your work, and you'll look through what you need to do for the day. You tend to go and see the sickest patients first and people that need to be discharged from hospital. There's a lot of reviewing each patient, a lot of ordering tests, writing your notes within the patient's charts, meeting with families. And medicine is a really rewarding career. You get to do really interesting things every day. It's also a privilege to share the really important points of a person's life with them. So we get to share birth, illness, death, and all the other sort of significant events. So it's, you know, a pleasure to get out of bed every day and be a doctor. In general, medicine's fairly well paid. To begin with, you might earn about $51,000 a year, but that rapidly increases, and so a fully qualified general practitioner might earn between $100,000 and $300,000 a year. And a specialist in private practice, particularly, for example, a surgeon, might earn a bit more than that.
There are two pathways into medicine. 150 places are offered to top Year 12 students who have an OP1 and perform well on the UMAT test. These students can opt to do an undergraduate degree, then UQ's Bachelor of Medicine, Bachelor of Surgery, known as the MBBS, which takes 7 years. Or they can study a dual degree, like the Bachelor of Health Sciences, with their medical degree and finish a year sooner. Graduates. Those who've already done a degree need to have maintained a GPA of 5 and sit the GAMSAT test to gain entry to the MBBS.
So the personal skills you need first and foremost are to care about people and to be interested in their well-being. You need to have intense intellectual curiosity and just be really interested and curious about the world and the people that you're dealing with. You also need to be dedicated and diligent, because the sorts of work that you're doing is important, and you can't be slack and haphazard about it. You're dealing with people's lives on a day-to-day basis. UQ is Queensland's #1 school of medicine, and some of Queensland's best doctors and most passionate medical educators are teachers here at the University of Queensland. We've got a long tradition of having educated very good Queensland doctors, and indeed very good doctors who've contributed to a whole range of really exciting international discoveries and changing medicine and health for people for the better throughout the world. Most recently, we've been really focusing on making sure that the experience that we offer students is world class, and so we're really focused on making sure that our students have got a good relationship with the people who are teaching them how to be doctors.
What I love about studying medicine at UQ is the access to world-class facilities, teachers who are ahead of their field in terms of research and practice on patients in the clinical setting, and the access that I get on a day-to-day basis to hospitals, the staff in hospitals and the patients, so that I can become the best doctor at the end of the day. Most of the experience that you'll get with teachers will be in the hospital setting, where you'll have access to doctors from a wide variety of disciplines, but also be taught by allied healthcare practitioners and nurses who can often provide you the hands-on experience that you need to get out there to be a first-year doctor. And then in terms of just general life, well, you've got everything here you could possibly need, be it lolly shops for late night study sessions, coffee shops. There's an incredible refectory district.
UQ's Bachelor of Medicine Surgery offers a highly regarded pathway to a career that makes a real difference to the lives of many. To find out more about studying health at UQ, visit UQ's study website, uq.edu.au/study, and click on Health.